When you work in healthcare for a number of years, regardless of whether it's in a hospital or a physician clinic, one realizes that this is an industry that is very fragmented. What patients should expect out of our healthcare is to be able to go to a hospital or physician practice and have one medical record, one bill, and access to any information they want for their care. Healthcare is so fragmented that in many situations that's not possible. And so I think where this really needs to go is the direction of hospitals, physicians, health plans, and other providers such as physical therapists, pharmacists, all working together on one team to coordinate care for patients to make it as easy as possible.
I would like to see that everybody involved in the healthcare, from the patient to the hospital to the physician, being more responsible and accountable for care. Even though I think the transition may be difficult, going from being paid on volume to being paid on value, I think that's a good transition. I think that we need to be paid based on providing really good care instead of just a lot of care.
You know, I think that long term, we're going to have to get ourselves in a position where there's much stronger access to care for the communities that we serve, that we are going to have to produce a product at a more reasonable cost to individuals. When you look at the economics of healthcare and the dollars it consumes relative to other sectors of our economy, it's growing rapidly. That alone is going to call for some significant change to the way we deliver healthcare. In our community, I think it's going to have to be something that our organization does collaboratively with physicians and other organizations. We need to come up with a different kind of community solution in how we're going to deliver healthcare together and not apart.
I think we as healthcare providers really need to work together to coordinate care. I think it's not working the way it's set up now. And I think us coordinating and bringing in services, access to our communities is a huge part of that. Cooperations, for example, we work with the other area hospitals to bring and employ surgeons into our area, which has allowed us to keep the costs at these high-quality hospitals around us. So our patients and community members do not have to travel and put that strain on their families. I think more of that needs to happen, working together with the other hospitals to bring in healthcare at cheaper rates. Telemedicine is another option out there to look at. Because physicians, we do not have a surplus of physicians, so we're going to have to be creative on bringing in services to our community.
Well, it needs to be affordable, accessible, reasonable to get the type of care that you need within a reasonable distance of where you live. I guess, and understandable for patients. I guess understanding how their care is going to come, how they're going to pay for it, what's going to be covered, those types of things.